Hello there, viewers. Welcome back to the channel. Hemorrhoids or piles are a common problem. These swollen veins inside the rectum or outside the anus can cause pain, anal itching, and rectal bleeding. Symptoms often improve with at-home treatments, but people need medical procedures on occasion. Eating more fiber can help prevent hemorrhoids. Hemorrhoids are swollen, enlarged veins that form inside and outside the anus and rectum. They can be painful, uncomfortable, and cause rectal bleeding. Hemorrhoids are also called piles. We're all born with hemorrhoids, but they don't bother us at baseline. Only when they become swollen and enlarged do they produce irritating symptoms. Today, we will show you hemorrhoid symptoms, causes, treatment, and prevention. But before that, make sure you've subscribed to our channel and hit the bell icon below. What are the symptoms of hemorrhoids? In most cases, the symptoms of piles are not serious and resolve on their own. An individual with piles may experience the following symptoms: painful lumps in and around the anus, itching and discomfort around the anus, painful lumps in and after passing stools, bloody stools. Piles can escalate into a more severe condition. Number 1. Causes. Straining puts pressure on veins in the anus or rectum, causing hemorrhoids. You might think of them as varicose veins that affect your bottom. Any sort of straining that increases pressure on your belly or lower extremities can cause anal and rectal veins to become swollen and inflamed. Hemorrhoids may develop due to pregnancy. During pregnancy, tissues in the rectum become weaker, and hormones cause veins to relax and swell. Hemorrhoids may occur in up to 35% of pregnant women. Aging. Hemorrhoids are most common among adults over age 50 years. However, young people and children can also get them. Diarrhea. Hemorrhoids can occur after cases of chronic diarrhea. Chronic constipation. Straining to move stool puts additional pressure on the walls of the blood vessels, which may result in hemorrhoids. Sitting for too long, spending a long time in a seated position, especially on the toilet, can cause hemorrhoids. Heavy lifting. Repeatedly lifting heavy objects can lead to hemorrhoids. Anal intercourse. This can cause new hemorrhoids or worsen existing ones. Weight. Research has linked being overweight to a higher chance of hemorrhoids. This may result from increased pressure within the abdomen. Genetics. Some people inherit a tendency to develop hemorrhoids. Number 2. Treatments. In most cases, piles resolve on their own without the need for any treatment. However, some treatments can help significantly reduce the discomfort and itching that many people experience with piles. Lifestyle changes. A doctor will initially recommend some lifestyle changes to manage piles. Piles can occur due to straining during bowel movements. Excessive straining is the result of constipation. A change in diet can help keep the stools regular and soft. This involves eating more fiber, such as fruit and vegetables, or primarily eating bran-based breakfast cereals. A doctor may also advise the person with piles to increase their water consumption. Losing weight may help reduce the incidence and severity of piles. Medications. Several medicinal options are available to make symptoms more manageable for an individual with piles. Pain relievers. Over-the-counter pain relievers such as aspirin and ibuprofen can reduce discomfort. Stool softeners. Stool softeners and laxatives can make passing stools easier, which can reduce pain from piles. Corticosteroids. Corticosteroid creams and ointment can reduce inflammation, pain, and itching. Surgical options. If a person has severe prolapsed piles or internal piles that are bleeding, surgery may be necessary. Surgical procedures for piles include banding. The doctor places an elastic band around the base of the pile, cutting off its blood supply. Hemorrhoids will typically fall off within a week. Sclerotherapy. A doctor will inject medicine into hemorrhoid to make it shrink and eventually shrivel up. This is effective for grade 2 and 3 hemorrhoids and is an alternative to banding. Infrared coagulation. During this procedure, a surgeon will use an infrared light device to burn the hemorrhoid tissue. Hemorrhoidectomy. This type of surgery involves the total removal of hemorrhoid tissue. It is the most effective option for completely removing piles, but there is a risk of complications, including difficulties with passing stools. Hemorrhoid stapling. During this procedure, a surgeon will use staples to block blood flow to the hemorrhoid tissue. Number 3. Prevention. People can lower their risk of developing piles with a range of lifestyles, including eating a healthful diet. Staying hydrated and eating a diet rich in high-fiber foods can help keep stools soft and make their passing easier. Avoiding heavy lifting. Regular heavy lifting is a risk factor for piles. Limiting heavy exertion and practicing proper lifting techniques can help a person prevent the development of piles. Maintaining a moderate weight. Being overweight raises the risk of having piles. Staying active. Exercise can help food passage through the digestive system and make stools more regular. This can reduce the risk of piles. Here we end up for today. Piles is another term for hemorrhoids. They are swollen veins in the lower anus and rectum and can cause lumps in and around the anus. Piles vary in size and location, and many people with piles do not realize they have them. Piles can be the result of overexertion, chronic constipation, and straining when passing stool. Many piles resolve on their own, but visible, painful piles may require surgery to remove. Hope you've enjoyed the video. If you have, hit like, share, and subscribe to our channel. And don't forget to hit the bell icon below. Thanks for watching.